1. Why do you want to be a care support worker with the NHS? I've always been passionate about helping others, and working for the NHS aligns with my personal values of compassion, respect, and commitment to care. I want to make a difference in people's lives by providing hands-on support and emotional reassurance, particularly when they are most vulnerable. The NHS's reputation for patient-centered care is what inspires me to be a part of it. 2. Can you describe a time when you had to deal with a difficult situation? While volunteering at a care home, I once helped calm a distressed resident who was confused and anxious due to dementia. I used a calm tone, active listening, and gentle reassurance. I redirected the conversation to something familiar to them, which helped reduce their agitation. This taught me the importance of patience and communication. 3. How would you ensure a patient's dignity and privacy? I understand that maintaining a patient's dignity is fundamental. I would always knock before entering a room, explain procedures before carrying them out, and ensure curtains or doors are closed during personal care. I would treat each patient as an individual, respecting their cultural or personal preferences. 4. How do you handle working under pressure or in a busy environment? I stay calm and prioritize tasks based on urgency and patient need. For example, if multiple patients need support, I assess who requires immediate attention and communicate effectively with my team. I understand that healthcare can be demanding, so I make sure to remain focused and ask for help if needed. 5. What would you do if you witnessed a colleague being unprofessional or neglectful? Patient safety and well-being are paramount. If I witnessed unprofessional behavior, I would report it according to the NHS whistleblowing policy. Initially, I might speak to the colleague if appropriate, but if the issue persisted or was serious, I'd inform a senior staff member immediately. 6. How do you support someone with mobility issues? I'd assess the patient's needs based on their care plan and use appropriate aids like hoists or walking frames. I'd communicate clearly, move at their pace, and ensure their comfort and safety at all times. Encouragement and reassurance are key to helping them feel confident. 7. How would you deal with a patient who refuses personal care? I try to understand the reason behind the refusal, whether it's discomfort, embarrassment, or confusion. I'd explain why the care is needed, offer choices to empower them, and approach them again later if they're still uncomfortable. It's important to remain respectful and patient. 8. What does safeguarding mean to you? Safeguarding means protecting vulnerable individuals from abuse, harm, or neglect. It involves being alert to signs of abuse, reporting concerns immediately, and ensuring patients receive care in a safe, respectful environment. I would follow the NHS safeguarding. 9. Describe how you work effectively in a team. I'm a strong communicator and always willing to support colleagues. I believe in listening, sharing information appropriately, and respecting each team member's role. For example, during a busy shift, I regularly checked in with others to see if they needed assistance and shared updates on patient care. 10. What are the 6 Cs of care, and why are they important? The 6 Cs are care, compassion, competence, communication, courage, and commitment. They're the foundation of NHS care delivery. They guide how we interact with patients and colleagues, ensuring that care is safe, respectful, and person-centered. 11. How would you respond if a patient with dementia became confused and tried to leave the ward? I'd approach them calmly and kindly, using a gentle tone. I'd try to redirect their attention by engaging in conversation or offering a comforting activity. I would not challenge them directly, as that can increase agitation. I'd inform the nurse in charge and ensure the patient's safety, documenting the incident as required. 12. How do you prioritize tasks when several patients need support at once? I assess who is in the greatest need, whether it's someone who is in pain, at risk of a fall, or requires urgent personal care. I also communicate with colleagues to delegate where appropriate. Prioritizing with a focus on patient safety and dignity is key, while ensuring nothing is overlooked. 13. What would you do if a patient confided something serious, like abuse at home? I would listen calmly, avoid making promises of confidentiality, and reassure them they did the right thing by speaking up. I would report the concern immediately to the safeguarding lead or senior staff, in line with NHS safeguarding procedures, to ensure appropriate action is taken quickly. 14. Tell me about a time when you worked with a difficult colleague. I once worked with someone who was often dismissive during handovers. I stayed professional and tried to engage positively, focusing on patient care rather than personal issues. I also raised my concerns privately with a supervisor. Open communication and mutual respect are crucial in any healthcare team. 15. How would you support someone with a terminal illness? I would provide physical comfort, emotional support, and respect their dignity at all times. I would listen without judgment, be present when they need someone, and respect their care wishes. I'd also work closely with the palliative care team to meet their needs holistically. 16. How do you ensure equality and inclusion in care? I treat every patient as an individual, regardless of their background, ethnicity, gender, disability, or sexual orientation. I adapt care to their personal needs and make sure communication is inclusive. I also challenge discrimination if I see it and report it through the correct channels. 17. How do you manage emotionally distressing situations, such as a patient death? These moments are emotionally challenging, but I remain professional and compassionate, supporting the family and ensuring the patient is treated with dignity. Afterwards, I debrief with colleagues and use support resources if needed. It's important to reflect but also protect my own mental well-being. 18. What would you do if you were unsure how to carry out a care task? I would never guess or take risks. I'd ask a senior colleague or nurse for guidance and refer to care plans and policies. Patient safety comes first, and it's always better to ask than to risk doing something incorrectly. 19. Describe a time when you went above and beyond for a patient. While on a shift, a patient was feeling extremely anxious before surgery. I sat with them, explained the process in simple terms, and even found their favorite music to help them relax. Their feedback afterward showed how much that small act meant to them. 20. How would you handle a language barrier with a patient? I would use translation tools or request an interpreter if available. I'd also use nonverbal communication like gestures or pictures. I'd be patient, speak slowly and clearly, and check for understanding. Clear communication is crucial to delivering safe, effective care. 21. What are your strengths and weaknesses as a care support worker? My strengths include empathy, teamwork, and reliability. I'm always willing to step in and help others. A weakness I've worked on is time management, especially during busy shifts. I've improved by learning to prioritize and using checklists. 22. How do you ensure accuracy when recording care information? I always record care immediately after providing it, using clear, objective language. I make sure to include the time, actions taken, and any patient response or changes. Accurate documentation is essential for continuity of care and legal safety. 23. What motivates you to work in care? Seeing the difference I can make to someone's life, no matter how small, motivates me every day. Helping someone regain their independence, or simply making them feel heard and cared for, is deeply fulfilling. 24. How do you balance the need to complete tasks quickly with providing compassionate, person-centered care? I use prioritization and planning to stay efficient, but I never let speed compromise the quality of interaction. For example, when supporting multiple patients with morning routines, I prepare equipment in advance and organize tasks in a logical order. But while with each patient, I'm fully present, making eye contact, explaining what I'm doing, and allowing them to participate at their own pace where possible. This way, I meet practical deadlines while still delivering care that respects dignity and builds trust. It's about working smart, not rushing. 25. How would you handle a situation where you suspect a patient is being neglected or abused? If I suspected neglect or abuse, my priority would be the patient's immediate safety. I would follow NHS safeguarding policy, which means not confronting the alleged abuser directly but recording my observations factually, date, time, what I saw or heard, and reporting them promptly to my line manager or safeguarding lead. I understand the importance of confidentiality, so I'd share information only with those directly responsible for safeguarding. Acting quickly but correctly can protect a patient from further harm, and I would never ignore my professional duty of care.